Okay, we've all been inside the doctor's office before. You might hear things get thrown around like a CT scan or an X-ray or an ultrasound or an MRI and all of those things. I think they're all the same machine. They're just calling it, but it's not. Every scan is different. Our next guest offers a scan that really can take a peek at what's under your hood to make sure you are in tip-top shape.
Yes, he certainly can. At Preventative Diagnostics, Dr. John Pierce joins us now. He is their medical director. Dr. Pierce, thank you so much for being back on the show. And we love what you're doing. You're helping people all across the valley have peace of mind. So when it comes to this imaging technology, not all scans, not all equipment is created equally. What is it that you are doing exactly?
Well, with our CT scanner, it's very unique. And we've talked about this before. We have like the only one on the West Coast outside of what they have for research at Palo Alto up in Stanford. Excuse me. So our scanner is a CT scanner. So there is a little bit of radiation involved with it. But what's neat about ours is it actually measures the individual so we can determine their density and the appropriate amount of radiation to give to an individual so we get the optimal imaging. So JJ, your scan is going to be a lot different than mine as far as the amount of radiation that's given. And that's in comparison to some other things that are around the valley. There's some companies that promote ultrasound, and the difference between ultrasound and CT is ours is going to give a more stable image, especially when we're looking at things in the body that move, kind of like the heart. So
Gotcha.
we're able to look at the heart and look at the coronary arteries versus with an ultrasound, they can look at the heart and the movement of the heart and see abnormalities there. And they can also look at the chambers of the heart. But they cannot see the coronary arteries to determine if there's plaque buildup or potential coronary artery disease, which leads to heart attack.
Well, yeah, which is super important. If you're able to catch that early, you're able to potentially save a life. So let's talk about the people that come in. They're coming in wanting to take, they just have maybe this thing in the back of their head saying, I know that's how you were, JJ. You're like, you know what? I'm getting a little paranoid. Let me just see. Go in for my tune-up, see what's going on here. In this case, if people do have a little bit of a heart risk, how do you help them? How do you help explain to people about their heart risks?
Well, we want to find out first, are they diabetic and how well they keep their sugars under control? If they smoke, if they drink alcohol in excess, if they have hypertension, those are all risk factors for coronary artery disease. Family history is another one. But what we're trying to do is we're trying to empower the patient. We want people to be able to take their healthcare into their own hands. So they can do a scan and we can find abnormalities like a high calcium score, which would lead them to go to a cardiologist to get further testing to see if that high calcium score is actually clogging up one of those arteries. Sometimes there can be plaque that goes along the length of the artery and really doesn't hurt the lumen of the artery as much, so it really doesn't slow blood flow down. So we want them to get further testing. When we see abnormalities in the lungs, we can see nodules and other growths in there. A lot of times we get a repeat scan in 6 months or so to see if that's changed, because that could be an early sign of cancer.
Absolutely. It's great to hear those scenarios and what it is that the scan can address. And I'm sure there's folks out there right now who really are tempted to come down and get this peace of mind, but they're wondering, how successful really is the scan. So I think, Doctor, right now we should pivot and show a soundbite from one of your recent patients.
Don wasn't feeling very well, and we went to a cardiologist, and they did all kinds of tests on him and found absolutely nothing and told him he was fine. That wasn't satisfactory. So we went to Preventative Diagnostic Center and had the body scan done. That body scan showed that he had blockage in his major arteries to his heart, and he had to have stents put in. That scan saved his life. I wasn't ready to be a widow, and I could have lost him. So please get the scan done for yourself and for someone you love.
It is just really reassuring to know that they, had such a great experience with the scan. Doctor, I've done the scan, and I can say that it is completely non-invasive, and it's also not claustrophobic at all. I know that's a big concern for a lot of folks when they think of going into a machine for a scan.
Yeah, typically most scans can be completed with 1 to 2 breath holds. So really we're talking, 20 seconds or so.
Wow.
It doesn't take a long time to complete the scan.
which is great. And it doesn't take a lot of money to do the scan right now. My goodness, the deal you have right now for a heart scan and calcium score, pretty decent.
Yeah, we're offering better than 2 for 1. So we're offering 2 scans for a couple for $125. Typically, we charge $599 for just one.
It's a great deal and a great opportunity to get on top of your health. Doctor, great having you, my friend.
Thank you, Dr. Pierce.
All right, take advantage of that special offer. Get your heart scan with calcium score for not just you, but your boo too, for just $125 total. That's it. Usually it's $599 per person. So take advantage of this offer. pdcenterlv.com, or you can call their number 702-534-7900. They're on South Tenaya Way in the Southwest. Go see them.